And that's a pretty good summary of the various inhalation products that are out there, what they can do, their contribution, and their benefits. What I'd like to do now is jump into answering a couple of your questions that were submitted prior to the webinar. First question is, does smoking or vaping damage the lungs like cigarettes? Well, first of all, anytime you put anything into your lungs, you have to be careful because this is the inside of your lungs are in fact sensitive to a lot of different things, and especially burnt material that you get when you smoke or have lighted material that you inhale. For example, cigarettes. I'll take that as an example. And also, candidly, when you're smoking a blunt, that's burnt material that's there, and you have to be very careful of that. Um, will they damage your lungs? Well, it turns out that cigarettes have a lot of carcinogens in them. It turns out that cannabis does not. So although it's less carcinogens, it typically is less, let's just say, less damaging to your lungs than smoking a cigarette itself. Vaping, again, is where they actually heat the cannabis without burning it. What they're doing with vaping is that you are essentially steaming the cannabis to a certain temperature, which causes it to then melt. And when they melt, it produces the steam that's used to be able to inhale, and that's how you use the vaping products themselves. Vaping is a lot safer than anything that has burnt material, cigarettes or smoking a blunt. So the answer to your question um, is it is it as dangerous as cigarettes? The answer is no, because the carcinogen level is significantly less. However, when you smoke a joint, it still has some carcinogens in it. And again, vaping almost eliminates all the carcinogens, so it really doesn't damage your lungs at all. And I should point out that in the pharma world, a lot of people who have asthma have inhalers that they use to inhale into their lungs, and it provides medical relief to the inside of their lungs. And actually, there are inhalers also for asthma and for other conditions like epilepsy that you can buy that are cannabis based. So, cannabis entering your lungs or marijuana that enters into your lungs, the method that's being used dictates whether it's going to be damaging to your lungs or not. It could be even therapeutic to your lungs, like these inhalers that you see that are available on the market. So the answer is really it is not as damaging as cigarettes. But again, I do want to caution anybody who's smoking at all, be careful about what you're putting into your lungs. I'm a big vaping fan. I'm not a big smoking fan for that particular reason. I just want to be as safe as possible. But I do have to admit, vaping is a great way of using cannabis, and it doesn't necessarily leave me, let's just say, with like the feeling of burnt material that I feel when I smoke something like cannabis or cigarettes themselves. So the answer is, it basically it's true. There is less of throat cancers due to vaping cannabis than smoking cannabis that's out there. And in fact, cannabis itself has less carcinogens than cigarettes and tobacco. So it's a little safer for your lungs. But again, anytime you put anything in your lungs, please be careful and be conscious of what you're doing. They said there. Next question is that I'm trying other compounds besides THC and CBD. Please advise on what brake fluids included on, let's see, please advise or please provide a breakdown on what is included on the flower label. Well, okay, this is what they call a certificate of analysis, or COA. Any medical marijuana product here in the state of Florida requires the seller, the dispensary, to have a certificate of analysis, or COA, for it. So when you go into the dispensary, you can ask them for this. They'll give it to you. Either they'll give it to you in printed format, but most of them have a digital one of these little little round things that have codes on it that you put your camera over. QR code, excuse me. You put that over the QR code, it'll pop up the COA so you can see what's inside the product. And they do that so that you can look at it when you're on the fly, whether you're at home or even in a dispensary. And what's inside of each of these products, as you can see, when you look at the COA, it'll tell you the route of administration that's being used, the product type classification, the potency, and also the terpene content. And this is an example of a product called Harlequin. This is from a company called Air, a dispensary called Air, or AYR. And this particular cartridge is a 1-to-1 vape cartridge. And I think this is important because a lot of people have a question of, is CBD available in smokable form? And the answer is yes, absolutely. It's actually available in vape form as well as smokable forms. And you'll find 1-to-1 cartridges as well as some flour that'll indicate that it has a certain amount of CBD in it that can really help you as well. I'm a big fan of one-to-one vapes because I just think they're a lot smoother. In my particular case, I'm trying to fight inflammation, so it helps me in there, and it also helps the CBD and the THC working together really helps to trigger the entourage effect. So there, hopefully this answers your question. Here's the breakdown. Anytime you need a breakdown, please feel free to go in and ask your dispensary for the certificate of analysis, the COA. Next question is, can I vape for fibromyalgia and sleep? And the answer is yes. There's a number of people. There's a number of people that I know, especially veterans, that have used that use vapes to be able to help themselves fall asleep. Now, here's what I do want to point out: when you're using a inhalation product, whether it's flower, vape, or concentrates, they typically work anywhere between 2 to 6 hours, mostly between up to anywhere between 1 to 3 hours. That's when you get the main benefits from the product itself. So if you're trying to sleep and you're trying to stay asleep for 8 hours in the evening, you'll wake up 2 or 3 hours from when you started to sleep, because the cannabis will wear off. Or even if it lasts for 6 hours, you'll wake up at 3 or 4 in the morning because the cannabis effect is worn off. That's why when it comes to sleep, I recommend using edible products, because edible products will last you between 4 to 10 hours, most average about 8 hours that's out there, and that's kind of the best way of going. But you still can use it for sleep. I know there are people that do. I have a good friend of mine that swears by it, so that's kind of her deal. And also for fibromyalgia, the answer is yes, because especially when you're using a one-to-one product, what you end up using is you end up getting into the CBD, which helps quite a bit with the inflammation and has a neuroprotectant capability. And that neuroprotectant capability really helps to address the pain and the symptoms of fibromyalgia. Now, the key here is not just smoking it or using a one-to-one inhalation product, which we're pointing out here. That's very, very important. The other issue is pay attention to the terpene profile. And again, you can find the terpene profile when you go to the dispensary, ask them for the COA, and you can actually just tell them, I'm looking for something that has, for example, linalool, myrcene, limonene, terpenoline. Just give them the list of terpenes that you're looking for, and they'll be able to give you a product that really helps. It has those terpenes in it that'll help you, whether you're looking for an edible or if you're looking for inhalation. And especially for vaping, they'll really help you there. Now, a lot of the vape products and a lot of the flower products are very high in THC with very little CBD in it, and there's nothing wrong with that. It's just if you're using it for trying to address things like fibromyalgia, you may want to kick up the amount of CBD in that particular product. It'll give you a lot more relief than product that's low with fibromyalgia in there. And also, I also want to point out in our library, our YouTube library, there is videos on fibromyalgia and on medical marijuana, and that's bit.ly/fibro, Fibro 102523. And then also for pain and for medical marijuana, you might want to look at bit.ly. And again, that's Pain Relief M. And those will actually take you right to these particular videos on this particular subject to address issues that you might have that's out there. So really pay attention to the terpenes, pay attention to the content of THC to CBD, make sure that ratio is there so that we can be able to address your particular condition and be able to address your particular needs. And I hope that really helps quite a bit with answering that particular question. This is an important subject. I think inhaling cannabis is really, really important. I am a huge fan of dryer vaporizers if you're inhaling. And the reason that is it's a vape. And that vape is not only gives you, I think, a better flavor than if you smoke a joint. It gives you the capability to adjust for the terpenes that you need for your medical condition. And then also, it's simple and easy to use. It's a lot cleaner to use than trying to smoke a joint. Excuse me. It's a lot easier to use than trying to smoke a joint or doing something like that. And I do want to conclude that if you're looking for a medical marijuana card, please look at MMTC of Florida. That's mmtcfl.com. They not only can help you get a card, but they do a great job of walking you through, especially the first 6 months of being a medical cannabis patient. They have a call center and a dosing center to help you be able to get the most out of your medical cannabis experience. If you're looking for a first-class cannabis dispensary, I suggest AYR, which is AYR Cannabis Dispensaries. They not only have great products, they have a very high quality standard, and they have an experienced and passionate bud tenders. These are people that work behind the counter that have really been trained to help you to bring the products to your attention and get you the products that you need to address your particular condition. I found them to be very easy to work with and also very helpful and help me with answering some of my questions on various products, what's in the products, like the COAs and that type of thing. And naturally, if you're looking for medical cannabis education, join us for our future webinars. Next week, we're doing one on edibles for consistency. Edibles are, again, a very hot topic. We'll talk about not only edibles themselves, we'll talk about the cooking with edibles. So check that out at marijuanaaware.com. And also feel free to go to our YouTube channel, YouTube/marijuanaaware, where you'll not only get this video, but other videos that can help you with your medical cannabis journey. I want to, first of all, thank you for joining me tonight. It's important that we get your feedback and we get this information out. And any questions you might have, please let us know. We'll be more than happy to answer those for you. So I thank you very much for joining us. Feel free to answer any questions and look forward to having you join us for our next webinar next week on edibles.